So I've had quite a lot of conversations with patients and with other staff members about when you should get a test for COVID. The government guidelines look like they're very clear until you're trying to decide whether you or your child fits into that category, and then it's actually quite tricky. So there are 3 reasons that you would get a test. The first one is a fever or feeling hot if you don't have a thermometer, and that is obviously fairly straightforward. The second one is if you lose your sense of smell or taste, again, should be fairly obvious. But the third one is if you have a new cough, and that has caused a lot of confusion for people that I've talked to. So generally, you can't tell the difference by symptoms from COVID versus any other respiratory infection. So a lot of people are finding that their children start off with clear cold symptoms, runny nose, sore throat, feeling a bit rough, and then develop a cough. And some people have said, oh, but because they've had a cold, does that mean it can't be COVID, or it can be COVID, what should I do? And the rule is simply, if you have a new cough, then you should definitely get a test. And it is really difficult, particularly in children, to tell whether it's a cold plus COVID, or whether COVID for your child is mainly a snotty nose. But if you have a cough, then you should get a test. The government guidelines describe a cough as continuous cough or 3 coughing episodes in 24 hours. As a respiratory consultant, I think that's really difficult. Some of us cough anyway. If you have asthma, you might cough quite regularly. If you have allergies. And essentially, if you think, I've got a cough or my child's got a cough, and I would describe that to someone over the phone, oh yes, they've got a cough, get it tested. I think you're much safer to get a cough tested than to worry about whether it is or isn't and sort of go backwards and forwards. If you think it is a cough and it's new, get a COVID swab. It's a safe test, it's straightforward, it's certainly inconvenient, but it's not the worst thing in the world, and then you know.